NCLEX-RN test bank with 800 questions and answers. Actual exam newest complete questions and correct detailed answers with rationales. Question 1. A client is at 9 weeks gestation. Which physical change should the nurse practitioner inform the client she will likely experience during this first trimester? Quickening, fetal movement, nausea and vomiting, weight gain of 15 to 20 pounds, apparent abdominal enlargement. Nausea and vomiting are common in the first trimester, up to 3 months, due to elevated human chorionic gonadotropin, HCG, levels and changes in carbohydrate metabolism. Quickening usually occurs at 18 to 20 weeks for first-time mothers. Weight gain in the first trimester should be modest, 2 to 4 pounds, and the uterus does not rise out of the pelvis to cause apparent enlargement until the second trimester. Question 2. A 38-year-old pregnant woman at 30 weeks gestation is at a higher risk for which condition specifically related to her age? Iron deficiency anemia, sexually transmitted diseases, STDs, intrauterine growth retardation, IUGR, pregnancy-induced hypertension, PIH. Physical risks for pregnant clients older than 35, advanced maternal age, include an increased risk for pregnancy-induced hypertension, PIH, cesarean delivery, fetal/neonatal mortality, and chromosomal abnormalities like trisomy. While anemia, STDs, and IUGR can occur in any pregnancy, they are not specifically increased by the factor of maternal age over 35. Question 3. A client at her 6-month prenatal checkup has gained 10 pounds in the last 2 months. How should the nurse interpret this finding? The client is compliant with her diet as previously taught. The client needs further instruction and reinforcement regarding diet. The client needs to increase her caloric intake immediately. The client needs to be placed on a restrictive weight loss diet. Recommended weight gain during the second and third trimesters is approximately 12 pounds total, about 1 pound per week. A gain of 10 pounds in 2 months is excessive. The nurse should reevaluate the client's eating habits and reinforce proper nutrition. Additionally, rapid and excessive weight gain can be a warning sign of pregnancy-induced hypertension, PIH. Restrictive dieting is never recommended during pregnancy. Question 4. To prevent perinatal mortality, what is the recommended serum glucose range for a pregnant client with diabetes? 40 mg/dl to 130 mg/dl, 90 mg/dl to 200 mg/dl, 70 mg/dl to 120 mg/dl, 100 mg/dl to 150 mg/dl. Tight metabolic control is essential during pregnancy. The recommended range is 70 to 120 mg/dl. Maintaining these levels reduces the risk of macrosomia and perinatal mortality. Higher glucose levels worsen the prognosis for the fetus, while hypoglycemia, below 70, can also have detrimental effects. Question 5. During labor, the fetal monitor displays late decelerations with tachycardia and decreasing variability. What is the nurse's priority action? Turn the client on her right side. Decrease the rate of 4 fluids. Report the findings to the physician or midwife immediately. Continue monitoring as this is a normal occurrence in late labor. Late decelerations combined with tachycardia and decreased variability indicate fetal distress and uteroplacental insufficiency. This is not a normal occurrence. The nurse must notify the provider, turn the mother on her left side, to increase O2 perfusion, increase 4 fluids, administer oxygen, and discontinue oxytocin, pitocin, if it is infusing. Question 6. What is the predominant purpose of performing the first APGAR score on a newborn? To determine the extent of congenital malformations. To evaluate the infant's vital physical functions and need for resuscitation. To obtain a baseline for future environmental adaptation. To determine gross abnormal motor function. The APGAR scoring system is used at 1 and 5 minutes after birth to evaluate the physical condition of the newborn, heart rate, respiratory effort, muscle tone, reflex irritability, and color. Its primary purpose is to determine if the infant requires immediate emergency resuscitation or intervention. Question 7. A pregnant woman at 36 weeks gestation with PIH develops proteinuria. Which food addition will provide the greatest amount of protein to her intake? 50 ml light cream and 2 tablespoon corn syrup, 30 grams powdered skim milk and 1 egg, 1 slice of whole wheat toast and butter, a small side of fruit salad. Clients with PIH and proteinuria need increased high-quality protein to replace what is lost in the urine. Powdered skim milk, concentrated protein, and an egg provide significantly more protein and essential amino acids than cream, syrup, or carbohydrates like toast.